second principle that's extremely useful but also somewhat fraught is the principle of double effect. Now this is a debated principle even today, but essentially it applies to a treatment which has both a good positive effect and a bad negative effect. So it's one treatment which has two effects. Now the question is, can I apply the treatment knowing that the bad effect will follow? The classic example, the textbook example, is the provision of pain control to a point where the next incremental dose of pain control, usually say with an opiate, will control pain for the patient but may suppress breathing at the same time. There are a number of conditions around applying the principle of double effect. One of them is that the good effect of the treatment must follow directly on the treatment and not by way of the bad effect. So for example, I give this medication to the patient and their pain is relieved because they've received the medication. It's not that they're comfortable because they're dead. They're comfortable first. So it's also important to recognise that this kind of treatment is ethically justifiable when there are no better alternatives. And as much as we would like to say we can keep all patients comfortable and lucid, at this stage that can be extremely difficult in some cases. And sometimes comfort comes at a cost. So the principle of double effect allows the clinician a degree of confidence when death is imminent, and very often this life-shortening effect of a medication is a shortening of hours, not of days or weeks. When death is imminent, the clinician can, with confidence, provide that next incremental dose of pain relief, knowing that death will occur, but not intending the death to occur. And there's a big distinction. There's much more discussion on the principle of double effect and this particular clinical issue in Catholic Health Australia's Code of Ethical Standards for Catholic health and aged care services in Australia. That's a standard reference, and I'd be recommending clinicians be very familiar with that.